So let's first talk about pre-admission testing. Pre-admission testing involves getting blood work and sometimes clearance from your physician specialist or your primary care physician. If you have heart problems, diabetes, possible other conditions that may affect your outcome in surgery and also could affect anesthesia, so we want to optimize those, make sure that you're safe for surgery. It would include blood work, sometimes electrocardiograms, chest x-rays, etc. Our team here at Capital Area Plastic Surgery will organize all those things for you to make sure that you're safe before your surgery. Secondly, let's now talk about how do we optimize our health before surgery. There are certain parameters or variables that you have total control of that can help you get a better result with your surgery, which is what we both want to achieve as doctor and patient. The first thing is smoking. Smoking, if anybody's come to my clinic, they have heard me talk about how bad smoking is, and most people know it. But specifically for plastic surgery, whether it's cosmetic surgery or reconstructive surgery, smoking can have detrimental effects on infection rates, making them increase. Also, flaps or skin can die off because the blood supply is not healthy. And therefore, if you look at all the literature, and if you've listened to me in my clinic, I always ask my patients to have at least 4 weeks where they haven't smoked any cigarettes, not even one. If you ever have the need to require help or ask for help for quitting smoking, we can help you with that. You can also talk with your primary care physician. And there's also the government here in New York State has many options and resources that you can get if you search online and just put in New York State quit smoking. The next subject matter I'd like to discuss about optimizing your health is alcohol and diet. We ask people to refrain from drinking alcohol approximately a week before surgery, as alcohol thins the blood and can cause increased bleeding. With diet, we just ask you to eat a well-balanced diet with less junk food and rather eat good whole foods to optimize your organisms and all your organs in your body so that you can heal better. It's also very important for you to give us a list of all your herbal medications, vitamins, minerals, and supplements. People think that these may be benign or innocuous, but they can sometimes cause bleeding, wound healing issues, interactions with other medications. So it's very important that we get a list of those, and we'll be able to direct you on what you can and can't take before the surgery or after the surgery. Let's talk about the night before surgery. Most patients know, but we will repeat it here, that having any food or drink after midnight before surgery going under general anesthesia or heavy sedation is prohibited. Surgeries would be canceled if it was known that a patient had anything to drink or eat after midnight. That includes chewing gum and also coffee, water, etc. It's an absolute rule that needs to be followed so that we can ensure your safety during surgery and none of your stomach contents can spill into your lungs. And that is why they have the saying NPO, or nothing by mouth, after midnight. Finally, let's talk about the day of surgery. The first thing you will do is obviously travel to the area or place that the surgery will take place, whether it be Capital Area Plastic Surgery in our private operating room or at the hospital or surgery center. You will need to find your way into the hospital and get registered. And then you also must have a companion to be able to take you home afterwards after the anesthesia period. Well, that concludes our video for preoperative planning for your surgery. Thank you for joining us, and we are pleased and honored that you have chosen myself and Capital Area Plastic Surgery for your surgical needs. Thank you.